Thanks for joining us today. My name is Amanda Byers, the President and CEO of the Beaver Creek Chamber. We've been working tirelessly to help you guys and businesses come up with as many resources as we can to push out to you. So this is another resource that we felt was extremely valuable at this time. So we reached out to one of our member sponsors to go ahead and provide a bunch of information for us today, a variety of things. So before we get started, a couple of housekeeping items for you guys. Please make sure you turn off any background noise if you are not muted. We do ask that you keep your microphone muted at all times during the presentation. Questions can be directed through the chat portal at the bottom of the screen. For those of you who have not used Zoom, if you go to the bottom of your screen, you're going to make sure you are displaying your chat as well as your participants. That's going to allow you to see who's in the room. Any questions should go through there. Alyssa will manage all of the questions and direct them to me. We will run those questions at the end of the presentation. So our speakers will go through the presentation, and then we will gather those questions and ask them at the end. If you would like to share your contact information in the chat, please feel free to do so. This is also a networking opportunity for you guys to be able to connect with peers as well. If you have any technical difficulties during the presentation, please send a chat to Alyssa. She is serving as the organizer, and I'll be serving as moderator. Once the speakers have finished, we'll open up the panel per se for them to answer the questions and get them read out. So if we have nothing else, and I believe all of our speakers are good to go, I'll go ahead and read some bios and then allow them to take the microphone, I guess. Since 1975, Spooner's family of companies has been a leader in reducing employment-related risks with workers' comp, safety, and unemployment. With the understanding that Ohio BWC's model doesn't fit every company, they launched their PEO, Surety HR, in 2018, allowing companies of all sizes to benefit from a self-insured model and manage employment-related distractions so you can focus on your business. So we have 4 speakers, I believe, today from the parent company, and each of them falls under a different area. So we have Lorraine Catalusi, is a native Clevelander who graduated from Cleveland Marshall School of Law, and her practice area has focused around labor and employment law. Her career began at a boutique law firm in Cleveland, where she learned various aspects of the labor and employment law field, including FMLA, FLSA, workers' compensation, and ADA, just to name a few. Today, Lorraine is general counsel for Surety HR and a member of the HR team. We have Todd Carastori. He began his HR career as a construction contracting firm in the Cleveland area, where he stayed for 15 years. In this role, he gained knowledge and experience with various aspects of the construction industry, including workers' comp, self-insured benefits, labor leasing, and union, which took into the PEO field. Today, Todd is the Director of HR for Surety HR. We have Matthew Janis, is a Senior Safety Consultant with Spooner Incorporated. He received his bachelor's degree in business administration from Baldwin Wallace University in Berea, Ohio in 2005. Since joining Spooner's safety department in 2013, he has performed over 1,000 client safety audits, conducting training classes, developed programs and procedures, and a range of other services to help companies comply with OSHA and reduce their injury rates. We also have Brandy King. Brandy joined Spooner in the Surety team in 2016 and a regional sales manager for Southwest Ohio after spending 10 years as a consultant in occupational healthcare. She served on the steering committee for the Dayton Valley Safety Council for 9 years, is involved with several chambers and trade organizations in the Miami Valley, and has been instrumental in Spooner opening an office in Beaver Creek earlier this year. At this time, we'll go ahead and get started. Speakers, if you just let me know when to advance the slides, and I will do so.
Go ahead and advance to the HR questions and concerns, please. One more. Good afternoon, everybody. We thank you for being with us today. Without further ado, we will jump right into it. Busy? First question is how we address employees who are afraid to come back to work. We would say very carefully. Everybody's going to be different when wanting to return back to work. So employers should understand and address employers' concerns relating to the coronavirus, you know, on a one-by-one basis if you can. A good first step would be to have a conversation with the employee. A lot of reasons for this. Some of your employees can be caring for parents or grandparents, have a spouse or live with somebody in the healthcare field, school and daycare, which is another big thing that you have to be concerned about. So you should specifically inquire what the employee's concerns are and whether those concerns are reasonable. So what we did here is we put together a questionnaire and emailed it out to all of our employees. And really the main question was, how comfortable do you feel in returning to the office? So, you know, you can use a sliding scale of 0 to 100. You can use a yes, no. But we got a lot of really good information from that. Beware, a lot of your employees who are working from home would like to stay working from home, so take that into consideration as well. But after you get that data, what you want to do is you want to funnel down to each employee and kind of drill down their concerns. You have to be careful, obviously, with ADA and HIPAA and a lot of related laws, but that's the best way that we found to go about it. And then when you do, you know, in the later slide, we'll tell you what happens when they do come back to work. So the next question is employees who don't accept an offer, who are on unemployment. A lot of people are getting more on unemployment than what they would working with the additional $600. It's a really short answer. If they're offered to come back to work and they refuse, then their unemployment will be denied. Obviously, tread lightly. If you can have somebody work from home and, you know, if you can have somebody work from home and they're still leery of coming in and you can accommodate that work from home, then I would still do that for, you know, the foreseeable future. But, you know, come 2 o'clock today, everything could change when we sit down and watch whatever DeWine is going to talk to us about. Next slide. So what are employers required to do? So if you have kept up on what DeWine was stating, 2 days ago, he had mentioned that employers have to wear masks. Yesterday that changed, so now face coverings will be recommended, which is probably the most question that we're getting asked right now. So it's up to the employer. If you want to have everybody wear a mask, you can. It's recommended. They do not have to, so they can kind of advise against that. Also, you have to ensure that there's a minimum of, you have to be 6 foot away. Again, if they can work from home and it's working out fine for the foreseeable future, that is also a good course of action to take. You have to establish a maximum capacity, 50% of the fire code. He also indicated that employers should provide mask for the employees. I know that was another question. They're coming out with a question and answer, hopefully today, that you'll be able to leaf through on the Ohio website. We have yet to see that, and we're hoping it comes through probably after they speak today at 2 o'clock. And lastly, it's also a very good idea to, be pretty lenient with your employees. These are trying times, obviously, and there are a lot of concerns floating out there with employees coming back to work and wanting to come back to work. So use best judgment and take that by an employee basis. Other than that, the basic hand sanitizing, washing your hands, keeping your area clean, staying in your office, still having these wonderful Zoom meetings that we're able to have now. Those things are some of the things that you should just follow, probably even past May 4th, when individuals can and should be reporting back to the office. Next slide. So this is a short one. Really, what are employers required to do? It's tough for us being in HR because it's changing daily, and that's to be expected. So following Governor DeWine's workplace protocols, always a must. Following all guidelines set forth by the FFCRA, that is a must too, and I'm sure you're going to have questions about that. And also, if we can get emails too after this, we'd be able to send out as much information pertaining to these rules and regulations that we can. What you should avoid doing as an employer, definitely not ignore any employee concerns. Take them one by one. Everybody has a different stance on this, has a different viewpoint, and everybody's situation is different, so you have to take that into consideration. And when dealing with your employees, you want to have your HR professional probably do that because you want to avoid any type of HIPAA-related issues, because we all know that there are underlying conditions that can and will have an effect on what this virus does to each individual. So that is something you have to take into consideration as well. Next slide. So here I'm going to turn it over to Lorraine, and she's going to talk about this for a little bit.
Good afternoon, everyone. Thank you for joining us. I'm going to go over the FFCRA, which is the Families First Coronavirus Response Act that was effective April 1st of this year. So basically, the FFCRA has two important provisions that employers should be familiar with. The first one is the Emergency Paid Sick Leave provision, and the second is an expansion of the Family Medical Leave Act, which we'll refer to as EFMLA. So there are 6 scenarios where an employer would be provided or required to provide the employee leave. The first one, second one, and third one are all individual to the employee, and they will be compensated at 100% of their pay rate for up to 80 hours. Number 4 would be 2/3 pay, so that's basically caring for an individual. And 5 would be, which is probably the most common one, is a parent caring for a child because of daycare or school closure. So that is the FMLA expansion, which we will get to in a minute. So a key question that we had been receiving was regarding number 3. So there were employees who had fevers that did not want to go to the doctor, did not seek a medical diagnosis, and they were wondering if they are entitled to pay under this provision. So the Department of Labor came out, because at first it was unclear, and specified that they have to be seeking a medical diagnosis to be eligible for the pay. So we just want to stress that, because if an employee is self-quarantining because they do not want to be at work due to fear of exposure, it would not qualify for pay under the Emergency Paid Sick Leave provision of this act. So number 5 is the, actually you can go to the next slide. So number 5 is the Emergency Family Medical Leave paid provision. So like I previously stated, that's 2/3 of the employee's pay, and it's for up to 10 weeks. So Technically, it coincides with the FMLA leave, which if you're an employer familiar with it, you know it's 12 weeks of job protected leave. This one's a little funny because the first 10 days of the leave is unpaid. So you have 10 weeks of paid leave in addition to 2 weeks of unpaid. So the employee can substitute their emergency paid leave under the provisions on the previous slide for the first 2 weeks. So it's a little confusing, but they do go hand in hand with each other. An important note about the Emergency Family Medical Leave Act provision, if you're not familiar with the FMLA, all of the job protections established under the FMLA apply here. So if you do have an employee requesting this leave, it is important that you are a little bit familiar with the job protection provisions of the Act. So you can't take any adverse employment actions against an employee for taking this kind of leave, can't cut their pay, get rid of their benefits, that kind of action. So it's a little tricky. Like Todd said, if anybody has any questions, please let us know. I do want to state that under the FFCRA, it establishes a refundable payroll tax credit for providing these leaves. So basically, the credits are applied directly against an employer and employee portions of Social Security and Medicare taxes and the amount of federal income tax withheld. So it is paid dollar for dollar by the government. If employers are short of funds and they can't afford to advance the money, they can apply for an advance from the IRS, and the form is 7,200 to get those funds so they can cover the leave for their employees. Next slide. All right, I think this is you, Matt.
Hey, good afternoon, everyone. This is Matthew Janis. Just wanted to address a couple slides here, just chime in real quick and cover a couple topics that we've been receiving questions about, and that is OSHA recordability, as far as your OSHA record keeping on the 300 log, and COVID-19. So the most common one is COVID-19 a recordable illness? And yes, it can be. This is kind of changed a little bit along the way as things have played out here with the pandemic. It started out as being across the board, yes, OSHA said it is a recordable illness to all non-exempt industries, meaning industries that are already required to keep their OSHA logs. And then a big update came out on April 10th, which said that they're actually going to ease up on their enforcement of this. So instead of enforcing the record keeping of COVID-19 cases, they're focusing their record keeping enforcement primarily to these three areas: healthcare, emergency response, which includes emergency medical personnel, firefighters, and law enforcement, and correctional institutions. So they're focusing on those three key areas, unless there is both number 1 and 2 below objective evidence that COVID-19 is work-related and evidence reasonably available to the employer. So if those two are existing for an employer that's thinking about whether or not they have to record a case, and say they're in manufacturing or retail or something else, if those two are confirmed, then yes, you'd probably have to record that. But it's got to be pretty obvious. It's got to be a case where it's really easy to connect the dots, but it's likely this is only applying to the three industries above. Now, furthermore, OSHA does not consider COVID-19 a case that falls under the common cold or flu exception. There's a specific clause within the record-keeping standard that exempts the common cold or flu from being recorded. This does not fall within that. It's not a common cold or flu. Now, to be recorded in the three key industries above there, it has to be a confirmed case. Now, you've probably heard phrases like, presumptive positive, or under investigation, or, suspected. That doesn't count as having to be recorded. It's got to be a confirmed case, which means at least one respiratory specimen has tested positive for SARS-CoV-2, the virus that causes the coronavirus. Now, still, furthermore, even if all the boxes above are checked and it looks like a confirmed case, it still has to be under the general record-keeping criteria. So it's still got to meet something like For example, days away from work or treatment beyond first aid. Next slide, please. Another common one, it's kind of interesting that a lot of people haven't thought about, but I have received questions about this, especially now more than ever with people working at home. Is a case work-related if the employee is working from home? And yes, it can be, but the key here is that it's got to be directly related to the performance of work rather than the general home environment or setting. So in OSHA's words here, this is something that they've answered. The answer, illnesses and injuries that occur while employees work at home, including the home office, are considered work-related if they occur while the employee is performing paid work at home and the case is directly related to the performance of work rather than the home environment. A couple specific examples here to illustrate this. If an employee drops a box of work documents and injures his or her foot, the case is considered work-related. If an employee's fingernail is punctured by a needle from a sewing machine used to perform garment work at home, becomes infected, requires medical treatment, the injury is considered work-related. However, if an employee is injured because he or she trips over the family dog rushing to answer a work phone call, that case would not be work-related. Or if an employee is working at home and is electrocuted due to faulty home wiring, that is not considered work-related, and that would not be considered potential for OSHA recording. So the key, again, it's got to be directly related to the performance of work rather than something in your home environment. And I believe we're giving it over to Brandy.
Good afternoon, everybody. I want to kind of bounce off what Matt was just talking about, because another question that we're getting a lot of is, will COVID-19 be considered a compensable work-related illness? So in other words, if somebody feels like they've contracted the virus at work, do you now have a workers' comp claim on your hands? And in somewhat typical BWC fashion, the answer is maybe. There's not a direct, clear, black and white answer. And similar to what Matt was saying, it's going to depend on how the virus has been contracted and the nature of your occupation. Generally, communicable diseases aren't inclusive for workers' comp claims because there's so much possibility for exposure, and it's nearly impossible to track where an employee may have actually contracted the virus because they're, of course, not in the workplace 24 hours a day. If you do, as Matt was saying, work in a job or an industry like healthcare, emergency medical, police, or a penitentiary system, that poses a different hazard or risk because there's such a concentrated amount of the virus. So then you may have possibilities for a claim, but most private employers outside of hospital systems and healthcare are not really going to run into this a lot. I know that BWC has assigned a special team of claims examiners essentially to only deal with COVID-19 related claims and appeals. So I don't think it's going to come up quite as much as people think it will, because BWC will be rejecting the ones that are plainly not easy to prove. Next slide. A lot of this has been answered for a lot of you already, because many of you have probably already received your checks, but a couple of weeks ago in early April, DeWine kind of made a plea to BWC that they give a dividend rebate back to private and public employers in Ohio, and they did vote to do that. So quite a few of you that are in this webinar and on the call may have already received your check from BWC. So this check is going to consist of your 2018 policy year premiums. And that will run, BWC's 2018 policy year runs from July 1 of 18 to June 30th of 19. So if you paid BWC premiums during that period, you should be getting, I'll say roughly 100% of that premium back, because the little discounts like Safety Council, Go Green, Lapse Free, those will be, your check will be less those amounts, but it will be as close to 100% as you're ever going to get. Will BWC allow employers to delay installment payments because of the COVID-19 hardship? As of now, yes. Any premium payments that were due in March, April, and May can be postponed with no penalties and no lapses. Now, the question that we've gotten a lot of following that is, well, what happens in June? Do we have to pay all 3 months at once, or can it be spread out over multiple payments? We don't have an answer to that. We've inquired with BWC about that question, and their answer was, we'll reassess this in June. I'm not going to make any speculations, but I think we all know that this is going to go on past June, especially for employers. So there will probably be additional changes coming from BWC, and I think we're going to talk about some of those on the next slide, if you can advance. Yep. So what they have done so far is extended program reporting and requirement deadlines. So they haven't said anything about the requirements for group rating and group retro rated employers. I feel like there probably will be an announcement coming about that in the near future, since the deadlines are approaching. But all of these programs listed here have had virtually all of their training requirements waived. From my understanding, Drug-Free Safety Program still has a reporting deadline of 6/1, and that's an extended deadline. That could change, but as of now, you do still have to do the reporting portion. I think the training portion has been waived. And fairly recently, they did waive the CEO attendance for Safety Council members. And this is big, because normally employers have to attend 10 Safety Council meetings a year. If you have attended 4 by the end of February, you will still get your rebate. All of this is contingent on every policyholder doing the true-up process on time in July. So that runs from July 1st to about August 15th, and that's when you report your actual payroll for the previous policy year. And all this is for private employers. Public employer requirements are going to be reviewed in June, so we don't know anything about that yet. Next slide. The other major change is that open enrollment for managed care organizations is not going to be held this May. Historically, MCO open enrollment has been held every even-numbered year in the month of May. What they have decided to do is move it to next May and make it every odd-numbered year from here on out. The MCO is selected by you, but you don't pay them directly. As an employer, they manage strictly the medical aspect of the claim. So this has nothing to do with your TPA, who is your group rating or group retro administrator. As far as we know, those enrollments will remain the same this year. We haven't heard anything otherwise. Next slide. These are some resources where we lean for the information that we go to stay up to date. So I'll let Todd and Lorraine give an idea of what each of those areas, what each of those websites can actually provide in terms of answers to questions and general info.
Do you mean for our part of the presentation?
On the resources page, Lorraine, we've got just a list of links for CDC, EPLA lists and things like that. So I was just wanting you to go over what people can actually get from those pages. Like if they're looking for a specific thing, which one of those pages would they go to? What can they expect to find?
Oh, okay. A couple of those are more safety related. So I'm actually not familiar. I'm more familiar with like the employment law aspect of this whole thing. And so I can speak to that, which would be the Department of Labor. They have a lot of really good resources on their page for employers, basically addressing the FFCRA, which we talked about, Fair Labor Standards Act considerations. And then Governor DeWine's website has a lot of good resources for employers in Ohio as well. The BWC frequently asked questions. If you have workers' comp related, questions, that's a good one to review as well. Matt, can you help me out with the safety related stuff?
Yeah, hey Lorraine, I can. The first one there, OSHA Safety and Health Topics page, that is kind of OSHA's hub of information that they've pulled together for this. One thing to mention is OSHA has not created any new standards for the COVID-19 pandemic, but they have pulled together a lot of good information, summarized a lot of things that they've pulled from like the CDC especially. And so that first link there is a good hub for OSHA, you know, a safety perspective on all this, and some recommendations that they have based on CDC. Again, a real helpful bunch of information, different links to other sources. The other couple that I put in there, the CDC general guidance, no surprise there. They're kind of spearheading all this, the recommendations and guidance. That seems to be where everyone is getting a lot of their information from. CDC preparedness and response planning. That's a good resource for, you know, it's kind of late right now to be starting a infectious disease preparedness plan, but that's a great place to go for future reference. A lot of examples, guidance, templates, things like that for preparing for something like this that will affect how your operations are playing out, your workforce, you know, supply chain interruptions, all kinds of things like that. And then EPA list of disinfectants. If you're thinking about disinfecting a facility, you know, from within as opposed to contracting that out to a third party, someone like ServPro, that EPA list provides a bunch of different products that have claims to be effective against SARS-CoV-2. So a great resource of cleaning products that you can refer to there if you're looking to do some deep cleaning in your facility.
And one thing that I didn't think to put on here, actually two things. It popped up in the chat window. The Beaver Creek Chamber does have a really great resource guide for employers on their website. So that's definitely a place I would look as a chamber member, and I have looked as a chamber member. The other place is companies that you might follow on LinkedIn. If any of you are on LinkedIn, feel free to look up Shorty HR or Spooner. We're posting updates, anything that we find essentially. We're either posting a link to one of our own blogs to explain it, or a direct link to maybe, you know, an official or government website that can help explain the changes that are taking place as they take place. So we're trying to do that as real time and up to date as possible. I think we can open it up to questions now.
All right, thank you guys. That's a bunch of fantastic information. I know there's a lot of details. What I'd like to do at this time, I have a couple of questions, but want to open it up to all of our attendees. If you have a question that you'd like to ask any of the panelists, please be sure to put it in the chat. Alyssa is processing that over to me. She did go ahead and put in the chat area the COVID-19 information resource page that the Chamber has created. We try to keep it up to date as quickly as possible as information comes down. We'll probably pull over some of these other pages as well. But we want all of our members to know that that is a resource that we've created pretty much from day one for all of you to be able to access, and we push information out as quickly as possible. One question we do have is, you mentioned about companies that can come in and do cleanings. Do you guys have recommendations of some types of companies to be able to contact as businesses see those needs come into place?
I actually just mentioned one off the top of my head, and I have heard from clients that have confirmed that ServPro will do a COVID-19 related cleaning of a facility. They're a big name in the business. They do a lot of you know, bloodborne pathogens and other related cleanings, and they will do this type of project.
This is Todd. We also had a company called Interfinish. What they did is they came in and pretty much fogged our building. So they'll go around your whole office space. They will fog everything with a fine mist. It gets on your keyboard, your mouse, ventilation system. It dries within approximately 1 to 2 hours. It doesn't leave any residue behind as well, so that'll kill 99.9% of germs as well. Fairly reasonable price as well, so if anybody would like that information, I can get that out as well.
That's great. We did have a question come through that wasn't related to actually asking you guys, but we will be sharing the PowerPoint via email to attendees. We will also be posting, we did record this, and we will be posting it on our YouTube channel as well for business to be able that weren't able to attend to refer to, and also for you guys to be able to refer back to. Do you have any other questions right now? Okay, anything else that you guys as the panel would like to provide?
No, nothing here other than, you know, if you get the, if you're able to watch the, you know, 2 o'clock briefing, please do, because there's going to be some more guidelines that pop up, I'm sure. So always a good resource to try and click that on or watch that at 2 o'clock, at least for the first 20 minutes. That's when you get the more meat and potatoes of what they're trying to get across.
We did have one question come through. Do we need a forehead thermometer to reopen?
Governor DeWine has not said that these thermometers are required at this point in time, and I think that's because asymptomatic carriers, some of them don't have a fever. So his guidance initially was check your employees' temperatures every day when coming to the office, but he has since moved away from that recommendation. Well, requirement, I should say.
Yeah, it's not mandatory. It's something that he has under the recommended tab for best practices.
Is there a checklist that you guys have seen that we could provide to businesses that they could kind of keep at the ready?
Yep, absolutely. I can get that over, it's called Responsible Restart Ohio, actually from the ohio.gov site, so I can get that. I can get that link over.
And that may be one that we already had on our site, but I just want to make sure that you guys aren't receiving something else that we haven't seen. So.
Yeah, this one updated as of last night between the mandatory and recommended, since he stepped back on a few things. So I'll get that link over ASAP.
Great, thank you.
You know, Todd, I actually have a question that a client asked me this morning, and I did not think to put it in the presentation, but with the backpedal on the masks for workplaces, for employees, can an employer require, as an employer's policy, that the employees wear masks for the foreseeable future in order to report to work and be paid?
They can require it. It would have to be provided by the employer as well. But a good rule of thumb is, you know, the more protective things you put in place, as far as I know, everybody's always concerned about a lawsuit here, but if you are in the best interest of your company and your employees, nothing's going to happen to you. So recommending or making it mandatory to wear a mask is probably a very good thing to do. And it all depends on the industry as well, but yeah, you can make that mandatory.
Would you recommend by doing that in putting it into a policy of some sort, or what kind of method?
You could do a temporary protocol for the company, like releasing an email saying, until further notice, these are, you know, the protocols due to COVID-19. You know, maintain a 6-foot distance between coworkers, sanitize your workspace, wear a mask, make sure that people entering the workplace are wearing masks. So yeah, you could do a temporary protocol for that reason.
Great, that helps. Thank you. Do we have other questions from anyone else? All right, it doesn't look like we have any other questions. I'm waiting to see if Alyssa's typing a CH. Nope, nothing else. Okay. All of you do see the contact information for each of our speakers on our slide here. Again, we will send out to all of the attendees the PowerPoint so that they have access to it, as well as, again, you'll see it on YouTube. We do want to thank each of our speakers for joining us today. I know everyone's busy in their own ways, different than maybe how it normally looks. But our main point for our members right now is to provide them the resources and the information to the best of our ability. And those are thanking you for providing the time to educate them. So before I let everyone go, just want to remind you all to register for our legislative breakfast, which is this Friday, May 1st, from 9 to 10 a.m. We're doing it via Zoom, how we're doing this. And without that, I don't think there's anything else. Thank you guys for
Thank you for having us. We're happy to help.
Appreciate it.
Thank you very much.
All right, everyone have a good afternoon.
Bye.
Thank you.